We're here today to talk about the pretty much the condition of primary care. One of the things that's happened over the years is that the primary care system, not only in Oregon but also across the country, has diminished tremendously from about 60% of all of our practicing physicians in the country down now to about 12%. And one of the major reasons that that's happened is because the way that we have paid our providers that changed in the early 70s and started decreasing the amount of payment for physicians who were paid on their time, and increased reimbursement for those people who did procedures like surgeries and outpatient and inpatient procedures. This has been one of the leading causes of the rise of healthcare in America and also in the state of Oregon. And one of the things that FamilyCare has done over the years is we have endeavored to pay our primary care physicians more than we pay those who do procedures in our network. Today what we are doing is we're taking what we hope is a very positive leap forward in that payment structure. Currently we have been paying somewhere around the Medicare rate system, the amount of reimbursement that Medicare pays, which is considerably higher than what the Medicaid system pays. We are taking a real leap forward, as we call it, to bring the payment up to about 80% of the commercial rate in the state of Oregon. I can give you the jargon. The jargon is that the conversion factor for payment on Medicare is about $37 per unit. Commercial rates are about $65 per unit. We're going to raise our rates up to $50 per unit from the current $37 to $40 we have been paying. What we hope this will do in the short run is it will give the opportunity for the physicians who are seeing our patients to open their practices to more patients, number one, and number two, to allow them more time to spend with their patients. Most of your primary care doctors, what they are paid for is their time. And with the low reimbursement, they have to see more and more patients on an hourly basis just in order to cover their costs. As we raise our reimbursements, they'll be able to spend more time with their patients. And frankly, time is what saves us money in the long run. It saves us in terms of ER visits when the patients can't get into the doctor's offices. It saves money by lessening the number of times that patients go to to specialists, because the primary care doctors do not refer as often. And it also saves on the procedures that are done, lab tests, MRIs, CAT scans, because the primary care doc keeps the patient in their office, is able to talk to them. It also saves a lot on what I would call the unnecessary ER visits, because one of the leading reasons people go into the primary care offices, frankly, is issues related to depression. And when the primary care doctors are able to see the patients, to spend time with them, to talk to them, to listen to them, that tends to give the patients some relief, and it also gives the doctor a little bit more time to figure out where they may be able to send their patients. So we're very excited about this. We expect to see in the long run savings in the outpatient costs for our patients, and more satisfied patients as we move forward.
It's well proven that, yes, where you have more primary care, you have better outcome and less cost. They've proven that on Medicare study throughout, especially using Florida, which is the worst of the worst and can be the best of the best, as a proving ground. And it's nice when we go back to DC and talk to the Congress, everybody realizes that primary care is underpaid for evaluation and management. and that it should be paid more, but nobody is ready to step up and take that first step and do it. And it's nice to see that FamilyCare is finally able to walk the walk and not just talk the talk. And they're actually stepping up and reimbursing the primary care providers at a rate where we can do primary care without just supplementing it from the rest of the population that you have. That's one of the reasons that primary care doctors have to think twice. If they were good businessmen, they would not take Medicare patients, would not take Medicaid patients, because why take more business where you lose money on every case? I haven't yet been able to get my staff to realize that when we see a Medicare enrollee, that they should get 50% less of their wages for that hour, because the practice is getting 50% less on a Medicare patient. But it's nice to see now FamilyCare is able to support the primary care so that it's not quite as much of a full giving away mission as just a still mission, that we can take time and we can develop a relationship with our patients so they can call us in the evening and not go to the emergency room for their cold or the kid that has the earache. We know you can do this, and I can work in the office in the morning, because not only is it cheaper care, it's better care.